Yeah, so here at ASH, I was very excited to share the results of our academic investigator-initiated phase 2 trial of Mosunetuzumab as a single agent for patients with newly diagnosed high-burden follicular lymphoma. This was a very nice collaboration with our colleagues at Hackensack in New Jersey and at the Lombardi Comprehensive Cancer Center in DC. So a very nice academic-initiated collaborative effort. This study uses a bispecific antibody called Mosunetuzumab. This is a first-in-class CD20/CD3 bispecific antibody that is used for the treatment of various B-cell malignancies, but it's FDA approved for the treatment of adult patients with recurrent follicular lymphoma in the third line and beyond. This drug can be administered intravenously or subcutaneously, and in this particular trial, we used it subcutaneously. And we really wanted to do this study because for the last 2 decades, the frontline therapy for high-burden follicular lymphoma has been traditional chemotherapy plus CD20 antibodies, and that hasn't changed in 2 decades. This approach has limitations. One is not everybody benefits from chemoimmunotherapy. Up to 15% of patients relapse early, and they're not well served by this approach. Additionally, chemoimmunotherapy has toxicities, including potentially very severe infections and life-threatening second cancers such as leukemia. So we really wanted to test an entirely chemo-free immunotherapy approach for this patient population, which is especially important for younger patients. So we overall consented 56 patients. We were able to dose 54 of them, and as of today, 45 patients are evaluable for efficacy. In terms of safety, this was really a well-tolerated treatment. The 2 most common adverse events were injection site reactions, which is an erythematous reaction at the site of injection, usually very mild, and this occurred in about 3/4 of the patients. And additionally, a cytokine release syndrome, which is a very well-known adverse event from bispecific antibodies as a class effect. Specifically, cytokine release syndrome was mostly mild, which is grade 1, and only 2 patients had a grade 2 event. None of these patients was treated in the hospital, and only those 2 patients were hospitalized. So it's a very easily deliverable therapy. Other notable adverse events were some mild viral infections and some skin rash. But what was really exciting to us were the efficacy results, and perhaps we weren't expecting such a high response rate. 96% of the patients had an objective response, and 76% of them had a complete response with a median follow-up of just under 6 months. So we were very excited to see what's going to come of these results with more mature follow-up. The other exciting part is that the results were very consistent across well-defined high-risk patient subsets. For example, those with a follicular lymphoma of grade 3A, or those with a high SUV, or those with a bulky disease, that is masses that are greater than 7 centimeters. So I think overall, we were very pleased with our experience so far. Subcutaneously administered, time-limited, outpatient Mosunetuzumab proved very efficacious in patients with high-burden follicular lymphoma. Preliminary efficacy results are on par with what you would see with chemoimmunotherapy. Clearly, we'll need longer follow-up to make sure these results are consistent over time, and also to solidify the safety profile of the drug. But certainly, I think our results support further exploration of this drug as a frontline option for patients with high-burden follicular lymphoma that is chemo-free and can be very valuable.